You've heard the hype. You've heard us talk about 7&UP. Today, I'm here to tell you that 7&UP isn't all about clubs and games. Today, I'm here to tell you why myself and the American Association of Orthodontists recommends that your child has an orthodontic evaluation no later than the age of 7. So let me tell you what's up with 7&UP. These early years of our lives are very critical to our growth and development. The habits that we form and the way our body develops at this age will carry on with us and will continue to have an impact on us throughout the rest of our lives. At the age of 7, we begin to see a mixture of adult and baby teeth in the mouth. The eruption of the first molars, which actually begin to erupt at the age of 6, will establish the posterior bite. With the posterior bite established, we will be able to evaluate the bite from front to back and from side to side. Many teeth will follow these first molars, and an X-ray such as this will allow us to identify if any teeth are missing, if there are any extra teeth, and if there are teeth that just don't know where to go. These nomadic teeth are of particular concern. Without any intervention, they often become stuck, or they may make their own way. This is a lateral incisor, one of the most important teeth in our mouth for aesthetics. Its fate looks grim. And here are a few more things that you can look for in your child today. Crossbite of the back teeth, where the top teeth are inside of the bottom teeth. Crossbite of the front teeth, where the top teeth are behind the bottom teeth. An underbite, the bottom teeth are in front of the top teeth. An open bite, when the front teeth do not meet when the back teeth are touching. Excessive crowding, when there's inadequate space for teeth to erupt into the proper position. Protrusion, when the top teeth are flared forward, which puts them at greater risk for trauma. Excessive spacing, this can inhibit the proper eruption of the adjacent teeth. Deep bite, when the top teeth are overlapping the bottom teeth excessively. And oral habits, such as thumb sucking, which can cause narrowing of the upper jaw and protrusion of the top teeth. At the age of 7, we will also see significant growth in the face and jaws. At this age, we have a unique opportunity to redirect the growth or eliminate habits that may inhibit normal growth. With this X-ray, we can evaluate the growth of the jaws in relationship to each other. Here we can see normal growth of the upper and lower jaws, and when we drop a line down the front of the facial skeleton, we can see that both jaws are on the same line. In contrast, we can see two extremes. Here we have it such that the lower jaw is set back relative to the upper jaw, and on the opposite end, we can see that the lower jaw is much further ahead of the upper jaw. Staying true to our commitment of going beyond the smile, we evaluate much more than just your teeth and jaws. You are not a floating smile. That smile is attached to every other part of your body, and that is exactly how we approach each individual when they come in for an examination. This is why we take a detailed health history and screen for things such as airway obstruction. Many may not know this, but a lot of the dental issues that we see here manifest from things like a narrow airway. Here you can see that the adenoids are enlarged and are blocking the airflow through the nose. This causes mouth breathing, which leads to an open mouth posture and often leads to a narrow upper jaw, amongst other things. This is just one of the things that we screen for when you come in for your orthodontic evaluation. The majority of our patients that come in at the age of 7 receive nothing but a couple of solid high fives and a passport. That is the entry to our kids club, Wesley's World Travelers Club. The WWTC is a fun club where members will get their passport stamped at each visit as we follow the eruption of your teeth along your smile journey. At each visit, we'll also take photographs of your teeth and jaws to monitor your dental progress. All this is done complimentary and with no obligation. My philosophy, like many orthodontists, is to only begin orthodontic treatment when it's absolutely necessary. This often means waiting till all the adult teeth are erupted. Unfortunately, there are cases, such as those that were just presented to you, where early intervention is needed. When those cases arise, we may need something like braces, an expander, or we may need to give you some exercises to stop a thumb-sucking habit. We are also unique. It is impossible for me in this video to cover everything you may want to know about the growth and development of your child's teeth, jaws, and face. Please contact Lifetime Orthodontics to schedule your complimentary exam where we can further discuss your individual needs. Feel free to send pictures via email to info@lifetimeortho.com or text me directly at 313-451-2166. Thank you, and I look forward to guiding you on your smile journey.